Good evening, everyone. My name is Allison McGeer, and I'm an adult infectious disease physician at Sinai Health, who had the misfortune to be thrust into the middle of SARS-1 low these 20 years ago, and have spent the last 20 years making a somewhat vain attempt to pay back all the people who came to rescue us during that emergency. So I have the advantage over some of the people here of age and long experience with emerging infectious diseases and other things that you don't want. I've been asked to talk about what the changes are since the first SARS event, and I'm going to start with the things that have not changed. And one in particular, and the reason for that is I understand why that's true, but I keep hoping that if we talk about it enough, that somebody will find us a path forward to make the change that we've all agreed we need to make, okay? I can quote you long lists of reports. Most recently, the commission of the Royal Commission for COVID Inquiry in New Zealand got published about a week ago. And what's not changed is that we undervalue and underinvest in public health. Your public health budget in Canada represents about 1.5% of the healthcare budget. And that would be okay if public health wasn't largely responsible for us living long, healthy lives. You think about your life, we all tend to think that the things that have made us live longer and feel better are better cancer treatment, biologics, precision medicine. It's not true. Okay? I've been in healthcare for a long time. I think I'm important. But what's making us live longer, happier lives is almost entirely public health. It's called vaccines and safe food and water and not smoking and responding to the opioid epidemic and getting rid of high sugar, large volume drinks. And, I could go on. Transit, poverty reduction, okay? These are the things that really matter. But we're not going to do that. And the short answer to why we won't invest in public health has to do with my professional life in infection prevention in a hospital. You know what a really good day in public health or infection prevention is? It's a day when nothing happens, right? But the key issue is understanding that it's not nothing happening just by chance. It's nothing happening because people are working really hard to make nothing happen. It's impossible to wrap your head around that fact and to fully appreciate it. And I've had any number of discussions. I remember very clearly a discussion with a quite famous head of ICU in a hospital that I was consulting for about an infection prevention program in their ICU that was not a totally inexpensive program. They looked at me and they said, "So I don't understand what it is that is causing you to spend all this money. If we had a problem, I can understand you doing something about it, but we don't have a problem." And I'm like, have you thought about why you don't have a problem, right? But none of us do that. So if there is someone in the audience who has the key to us moving forward on being able to invest in public health, that more than anything else is what we need. Because what public health people do is prevention, right? And if we doubled their budget, that would be the single most important thing we could do about pandemic preparedness, because pandemic preparedness is what they do for a living, and they're good at it. Okay, so we're not going to have that, though. So let's talk about what we might have, okay? What we got at a system level nationally in Canada out of the first SARS outbreak was the Public Health Agency of Canada. What we got in Ontario was Public Health Ontario, both intended to do the same thing and both given really ambitious mandates about responding to emerging threats and reducing infections. And neither one of them have really lived up to their promise, okay? Not perhaps surprisingly, given funding and just how much we were expecting of them. So when COVID came, I think all of us were a little disappointed in both of those organizations and their ability to respond. And that leaves governments with a choice now about what to do, right? You can either say, okay, these organizations are what they are. It's not like they haven't done a bunch of good things, but they're not going to be able to live up to what we wanted them to do in terms of preparing for emerging threats. So we need to rethink what they're doing, rebuild, reimagine what these organizations are. Or we can say, just going to leave them the way they are, and let's try to build something else. And I don't actually know what Ontario is doing, which doesn't mean people aren't thinking about it and doing something, just that I don't know about. At a federal level, we have made a conscious decision, and that conscious decision is that the Public Health Agency of Canada is having its budget reduced back to pre-pandemic levels, taking a lot of cuts, so we're not making that kind of change. And that's maybe not as disappointing as you might think it would be, because one of the things that we learned from the COVID pandemic, or relearned maybe from the COVID pandemic, is that pandemics are not just a health event. Pandemics are a whole of government event. And so leaving health with the entire responsibility for preparing for pandemics, not probably the best idea. So we have two things at a federal level that are starting now. The first is called the Center for Research on Pandemic Preparedness and Health Emergencies, okay? This is good. I wasn't supposed to use acronyms tonight, and you can't make an acronym out of that, so that's good. And that is part of the Canadian Institutes of Health Research, which are a federal research funding body, and their goal is to fund pandemic preparedness research and to build the coordination of research across the country during pandemics so that we have less duplication and more focus when we do that. How well that's going to work? Well, as my great-grandmother used to say, the proof will be in the pudding. I think there's a lot of concern that that center is currently a bit narrowly focused and probably underfunded, but we will see how they will do. The intention is clearly of significant value. And the second one's already been mentioned, which is the Health Emergency Readiness Canada, and that is outside of the health portfolio. It's in Innovation, Science, and Economic Development, which those of you who are as old as I am might remember as Industry Canada. And that organization is a mix of the US organization called BARDA, which is a government and industry-funded organization to develop new technology for therapeutics, for diagnostics, for emerging infectious diseases of all sorts. And the European Union agency, which is called HERA, which is a much more public health-focused organization than what we're now calling HERC, Health Emergency Readiness Canada. The goal is to create an ecosystem in which we invest in new technology, we develop new technology for Canadian manufacturers, we build life sciences capacity so that we are ready for the next pandemic. At a personal level, I have to say I would have liked to see more of a mandate on emergency preparedness and on public health in HERC. But again, there's lots of room to move within that mandate And I think there's no doubt that whatever comes out of it will be really helpful with moving us forward. I'm just still not sure that we've learned the lessons about public health. And then lastly, I'm going to, because my timer is off, so I don't even know where I am in my 7 minutes, okay? I'm going to steal another minute and just talk about a little bit about what Fahad talked about science advice to government and how difficult that was. And the good news is that you can see already that the Public Health Agency of Canada is, I think the right word, experimenting with having different science advice committees and sort of trying out for size the different size and shapes, because science to government is a really large challenge, and science to government about emergencies is even harder because you don't know where the next emergency is coming from, and you don't know who you're going to need. And so building structures that will work for that, I think, is really difficult. If you read the Wellport report that I had the honor to be part of with Fahad, it's very much based on a recommendation that we build something similar to the UK. The challenge with that is that SAGE for the UK, their Science Advice Committee, worked beautifully before the pandemic, did all sorts of nice work, but really didn't function well at all during the pandemic. And so to me, the science is still open on what the right structure for science advisory committees at a federal government are. And so what we really want to see is that the federal government is working on trying, and the provincial government, working on trying out those strategies to see how we can build them so that we get the best science advice to government going forward. Thank you.